Oh, going after. Okay, focus. Probably tastes awful. Scorpion snacks, milk challenges gone wrong, and what exactly is happening here? Today we're back at it, breaking down and reacting to all of the crazy medical scenes and over-the-top injuries from the highly popular YouTube channel IShowSpeed. Sometimes Speedy gets a little loud, so fair warning, you may want to turn your volume down just a bit. And a big shout out to Speedy for reacting to my react. I loved it. Let's dive right in.
I will be eating a black scorpion that is venomous, sold only in Pakistan.
That is huge. Venomous creature, typically it has to inject something into your tissue versus swallowing. I see people that come to the emergency department that get stung, bitten, snake bites, scorpion bites. Sometimes you can get different types of spiders. Those are the things that we see.
Alright, bro, the black venomous scorpion, 10% chance of dying.
I don't know where he gets this 10% chance of dying. Wouldn't know where that comes from in the sense of these are quite rare to cause serious abnormalities or serious complications.
My heart's beating, bro. Just honestly gotta do it.
Heart beating because his adrenaline's up. He's nervous, so he's getting a little bit more blood flow and heart rate's up. His sympathetic nervous system is kicking in. So that's why you're having those effects. Oh, going after. Okay, focus. Probably tastes awful. He's chewing it. He's not having a reaction. It doesn't happen that fast if he's having an allergic reaction. It's probably more disgusting and he has to choke it down, so to speak. He's giving us a nice view. His airway is nice and open. You can see all the way back in his posterior pharynx as he has his tongue down. When I actually ask people to open their mouths and say ah, the reason why you say ah is it drops your tongue.
I'm about to die! I just ate a scorpion, I'm about to die, bro! It's venomous!
So it's venomous is the word that he's trying to say. Again, the likelihood of anything catastrophic happening is super low unless it's related to an allergic reaction.
911, what is the address of your emergency?
I just ate a scorpion. I just ate this scorpion. I just want to know if I'm okay or not.
I'm not a medical professional. I can't tell you that. I have to send somebody to you.
Yep.
No, I'm scared. No.
Getting medical advice over the telephone, a lot of times you can't do that. You call your doctor's office and you talk to the nursing hotline. They, majority of the time, will tell you to go to the hospital because they can't definitively say one way or another.
I can't tell you that. I'm not a medical professional.
My advice to anybody, since this is in envenomation, is to actually call poison control.
Okay, bro, I need to call a veterinarian.
What's your last name?
Griffin.
What's your pet's name?
Stewart.
You're probably going to want to contact the Poison Control and Animal Poison Control Center.
Poison control here in the United States is a very simple number. You can Google it really fast, but it's 1-800-222-1222.
Vacuum challenge! Right! Freaking now.
Okay, what is a vacuum challenge? Anytime I hear a challenge
accepted.
it's never anything good. You gotta be really careful with the challenges that you hear randomly on social media platforms. You can definitely see that is causing compression and tightness to his tissues. So the biggest thing I always worry about is if there's too much pressure on those areas, is it causing decreased blood flow for too long a period of time? If the squeezing is too tight, not allowing blood flow to the tissue, that's actually when it becomes detrimental.
It's like a damn workout, chat. I can't move, I swear to God. I swear to God I can't move, chat. I swear to God I can't move. I cannot move.
Sweating bullets, yes, it's not breathable. So as you're increasing your stress, you might start sweating and it has nowhere to go. So you're actually gonna start sweating even more. You don't wanna get overheated and cause other issues.
I have to cool down.
Imbalances in your electrolytes.
Look at my body.
See, it's quite sweaty because it couldn't get out.
I'm glad he helped me though, chat. I probably wouldn't be alive right now if it wasn't for him.
That's what happens when people get into panic attacks and anxiety. In that moment, you can't focus the way that you normally would. In a situation where you start to have panic, take a step back, take deep breaths, and try to focus so you can get out of the situation.
Do not try this at home. I don't know what this is about, but let's go. Straw challenge, baby. Here we go, bro.
Okay. Oh God, be careful, you're gonna inhale that. Yep, yeah. He's trying to use a massive straw to drink milk. So it's very difficult to drink in that position with that amount of volume coming in. So then do you get it in your airway or not? Typically, if you're gonna get something in your airway where you aspirate it into your airway, it's gonna cause you to immediately start coughing and choking. He's freaking out. Come on. Sometimes you can pass out from the simplest things, and it could be just from your brain nerve interaction. It messes with blood flow relating to the rest of your body because the nerve sends a funky signal to your heart and causes a quick arrhythmia, boom, and then you can pass out, and then you wake back up shortly thereafter without any long-term issues. Say you come across somebody who's in this situation and you don't know what's actually happening. Most of the time, you basically want to either lay them on the ground, lay them on their side, and make it safe for that individual. It helps clear the airway, and then it basically allows normal blood flow.
Oh, bro, I thought I died, bro. I swear to God, I almost died, bro.
A lot of times too, you won't actually remember what happened. So if you have a seizure, you don't remember what happens.
Where am I?
It actually causes an issue with that. A syncopal episode, when you pass out, you actually don't remember what actually happened during that event either. You remember just before it and just after it.
What?
Nice. When you're lifting by yourself, it could be beneficial, so you can actually slide the weight off if you get stuck. But if you don't lift perfectly straight, it could start moving and then it is off-centered, so you can actually have a more difficult time trying to lift it. So now he's stuck. And I know you've definitely seen lots of videos out there of what people do when they get stuck. The biggest thing you do is probably try to either roll it down your abdomen to your hips so you can stand up, or you try to dump the weight on either side. So again, a little bit of panic. There you go. Take your time.
Keep breathing. Stop, I can't breathe.
One, he's saying he can't breathe because the bar is probably resting on his chest. It's definitely a moment where everybody panics. He's trying to actually dump it and the weight's getting blocked. So the best thing to do would be to try to lower it down your chest a little bit to then get it to turn over. There you go. So just that movement right there where it's partially off his chest at an angle gave him some relief, so his right side of his chest is actually free to expand. There you go. There you go. Now it's on the floor, it slid off. Typically, you don't see people come in with like fractured ribs of the chest in this situation unless it fully drops. Drop! You have cartilage on either side of your sternum that actually can give a little bit. I've been in situations like this. Either you're not strong enough in that moment, or you took it to one extra rep that you shouldn't have, and you're in this circumstance. IShowSpeed, I love his channel. I'm glad he's okay. Please don't do any of the things that he does on his channel. If you guys enjoyed my take on this and the medical things that could happen, please definitely check out this playlist right here, binge watch everything. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Also, big new things on the horizon. Check out my brand new supplement company, Life Happens. Thanks so much for watching, and stay healthy, my friends.